Good afternoon. Thank you again for joining me for this podcast. My name is Jordan Mayberry, and I am a physician assistant in Dallas, Texas at UT Southwestern. I've been practicing in hepatology for a little over 12 years. And of course, I treat a lot of MASLD and MASH in my practice. And so today we're going to talk a little bit about some common questions that come from our patient population whenever we are discussing their diagnosis of MASLD and MASH. I think probably one of the most common questions that comes from our patients is, what caused this? How did I get this diagnosis? And so we often talk about these cardiovascular risk factors. And so I will talk with my patients about those risk factors including obesity, diabetes or prediabetes, hypertension, hyperlipidemia. So we'll go through some of those risk factors and whether or not they have those risk factors. Of course, we know there can be a genetic component as well. So living in Texas, we do have a large Hispanic ethnicity population. And so because of that, they are at higher risk. They can be at higher risk because of the genetic predisposition. So often we'll talk about the possibility of genetics and how that plays a role in the diagnosis of MASLD and MASH. Of course, another common question from our patients is, how do we treat this? And so we talk a lot about risk stratification. So we will first do some sort of fibrosis assessment on the patient. We tell them that fibrosis assessment is really critical whenever we are talking about treatment for patients, because we know if they have early stage disease, so stage 0 to 1, then we really just focus on risk factor management. We focus on weight loss, we focus on lipid control, we focus on diabetes control. But if they fall into that at-risk category of stage 2 to 3 fibrosis, then we can talk about medications such as Rezdiffra for the treatment of at-risk MASH. And then, of course, if our patients have cirrhosis, then that management gets a little bit more complicated and that conversation really does get more extensive. And then finally, I think the most important question from these patients is, what does this mean? What does this mean moving forward? And what does this diagnosis entail? Or what is the prognosis of this diagnosis of MASLD or MASH? And that's really dependent on the patient. It's going to be dependent on the fibrosis score. Of course, we're talking about one moment in time. And so I always say to my patients that this is a progressive disease. And so it's really dependent on how well we are able to manage these comorbidities and how well we are able to manage their diabetes, weight loss, and that will also play a large role into the prognosis of their disease. I appreciate you joining me this afternoon, talking a little bit about some of these common questions that we get from patients. I hope this was helpful for you to kind of think about whenever you are having a conversation with your patients that have been diagnosed with MASLD or MASH. Thanks again for joining me.